Hello and welcome to the very first episode of Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a question that pediatricians are commonly asked in 5 minutes or less. The clock is ticking, so let's get to it. I'm Dr. Jess Steier, a public health scientist, and today we are joined by both of your soon-to-be pediatrician besties, Dr. Dina DiMaggio and Dr. Anthony Porto. And we thought it'd be a good idea to do some quick round-robin introductions so you get to know your hosts. Dina and Anthony, let's get to it. So, Dina, tell us, where are you from?
So my family's originally from Brooklyn, but we moved at a very young age to Long Island, where my family still lives. So you will occasionally see and hear my Long Island accent.
And Anthony, where are you from?
I'm also originally from Brooklyn, New York. I lived there most of my childhood and before going off to college, and my family still lives in Brooklyn.
And guess what? You'll notice a pattern here. I, Jess, am also from Brooklyn, New York, specifically South Brooklyn. All right, let's talk family life. Married, kids, Dina, let's get to it.
Yep, I live in New York City on the Upper East Side with my lawyer husband, 2 preteen daughters, my elderly little dog, and my feisty rescue kitten.
Anthony?
I moved out of New York City about 12 years ago, and I live in Connecticut with my husband and my 2 young children who are 9 and 6 years of age, and our dog, Rosie.
So I've moved around, but I've settled in Western Massachusetts with my husband, Ethan, who's an emergency physician, and our 2 kids. Dylan is 7 years old and Sophia is turning 6 in a couple of months. And I'm a major animal lover, so I have 4 rescue dogs and 2 rescue cats. So what are we doing now? Dina, what's your day-to-day like?
I'm a general pediatrician in New York City, and I'm very passionate about infant and toddler nutrition. And Anthony and I are both consultants for the research arm of the infant formula company, Bobby.
And Anthony?
So, Dina and I met during residency, and now I'm a pediatric gastroenterologist in Connecticut. And I see patients who have problems with growing and also with celiac disease and help them make sure they get the best nutrition as well.
So I, Jess, as I said, I'm a public health scientist, and my specialty is health policy and program evaluation. So I'm the CEO of Vital Statistics Consulting, which is a data science consultancy. And I'm also founder and co-host of Unbiased Science, which is a podcast and science communication brand. So let's chat about, why are we launching Bytes of Health? Why are we doing this? Dina, Anthony, you want to jump in?
Sure. So, we were doctors, and then we started having kids, and we realized that we didn't really know much about how to feed our kids. So Dina and I wrote a book called The Pediatrician's Guide, and that really got us passionate about sticking to the science and sticking to research. And so we really wanted to get the best information to parents and have been really involved with public education.
And I think, too, there's so much noise out there right now for parents, and everyone's telling parents what to do and what not to do. And we just basically want to tell you it's okay. It's all going to be okay. We're just here to provide evidence-based research and good advice based on our clinical experience and our research experience in our own lives. It's all okay.
And we bonded, obviously, we met when we were collaborating on a Bobby Labs research project. We hit it off. I don't think it hurts that we're all from Brooklyn. And, I think, as you both said, we're very passionate about sharing evidence-based recommendations and communicating science. And so, as Dina, as you just said, I think our goal is to bring some peace of mind and share some evidence with folks.
So the whole point of this podcast was we understand the difference between what the ideal is and what the reality is of parenting. And we want you to hear from us, but also pull in all of our friends who are experts in their fields.
Yeah, that's a great point, Anthony. So you guys will see that occasionally we'll be bringing on other experts, other clinicians, other researchers to help share their expertise as well to really build out episodes. And one last note, you may have noticed, but we are chatty, we're talkers. And so obviously our goal is to keep episodes to 5 minutes or less, but occasionally we might run over just a little bit. All right. Well, we hope that you enjoyed this brief overview of where we come from, why we're doing this. And we thank you for tuning in for your daily bite of health. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. Until next time, we wish you happy, healthy, and stress-free parenting.